Stephanie has a large 3-volume set of Alinsky organizing books that are 4-volume, that can be purchased on Amazon. But this little book is a great starter book. It's about organizing the culture of death using congregations for progressive politics. And this is what Doug was talking about, and I think Dr. Byrne might have mentioned an aspect of that. So this is what's happening. They're using the churches. They're infiltrating our Catholic parishes. Doug showed the bulletin notice. We were at a parish when we were traveling a couple of months ago, and I picked up a brochure that was all about the local hospice, that you could volunteer for this, you could volunteer for that, and it was like, I don't know. But so it's happening all over the place, and it all sounds very benign, but it's all being transformed. And I think everybody realizes, we have to be careful when we talk to people who aren't too familiar with this, and remind them that yes, there are some good people in the hospice movement. There are some good people doing palliative care. Just because you're called a palliative care doesn't mean that you're in here to pull the plug and kill you. But the problem is, eventually, as the corruption continues, these people are being trained in that particular orientation. And so it is going to get worse and worse. And there will be fewer Dr. Burns, and there will be fewer nurses who really care, and more who look at you and think, somebody. And this is a woman who was in a locked-in state, and she said she heard a nurse. She heard everything going on, and one nurse would talk to her, and then other nurse came in and never said a word to her until one day she heard her scream out into the hall, "Somebody come and help me move this thing." So that's where we're moving, and that's why it's so important for all of us to be spreading the word. And I'm taking up too much of Stephanie's time, but she can have as much as she wants. And I do recommend this book. It's only $5 on Amazon. She sold all the ones she brought with her at a meeting on Wednesday, so none left for us, darn. But I introduce my dear sweet friend, Stephanie Block.
This is going to take some getting used to. In Doug's talk, you heard mention of some organizing networks, Gamaliel, PICO, the Industrial Areas Foundation. People's organizations, neighborhood organizations, community organizations, they go by different names, were the brainchild of a man named Saul Alinsky. He was a man who lived in the 20th century, was a sociologist in Chicago who had a socialist worldview. He saw the world in terms of haves and have-nots. And in order to help the have-nots take away from the haves, these are his words, not mine, he created these people's organizations, loosely based on the idea of union organizing, in which radical organizers could identify local leadership to collectively fight for political purposes. Every time I turn a page. Oh, bless you.
Every time you turn a page?
Every time I turn a page.
Very good.
So in time, he brought these various people's organizations that he was creating and experimenting with. This was a new idea, under an umbrella called the Industrial Areas Foundation. That was the one network that he founded. And today there are about 60 of these local affiliates around the country. The IF trained new organizers. Many of those organizers remained within the IF network, but some of them went out and founded their own networks. Gamaliel was one of them. PICO was one of them. And each of those networks has their own set of satellite affiliates. So that's hundreds of people's organizations that all have their own names. So it feels kind of confusing. But they all have that same Alinskyan foundation. They all use the same methodology. And they all have the same progressive political purposes. This slide shows one of these locals. This is OCCCO. It's a Southern California affiliate in the PICO network. That acronym stands for Orange County Congregation Community Organization. I don't know how clearly you can see the membership. It's an institutional membership. Individuals don't join this kind of organization. Some of the Elitskian networks do have individual memberships, but not in PICO. So you have institutions, and in this case, all the institutions are members of congregations, religious congregations. So we call this kind of an institutional organization of organizations faith-based. These institutions represent a wide spectrum of moral beliefs, all the way from the Unitarian Universalists who think abortion is all right, who think birth control is all right, who think sterilization is all right, who would support compassionate choices of euthanasia, same-sex marriage. And then all the way to the other end, you've got Catholic congregations who would theoretically anyway, or doctrinally be opposed to all of that. This particular PICO affiliate, this OCCCO, is a partner in something called the Santa Ana Building Healthy Communities. If you look at the logo behind me, you notice there's a church that's part of the Santa Ana Building Healthy Communities. Building Healthy Communities is a 10-year initiative, 2010-2020, so we're right dab in the middle of it, to transform 14 California communities, Santa Ana being one of them, into places, and I'm going to quote, where children and youth are healthy, safe, and ready to learn. So Santa Ana is one of these communities that's going to be transformed into a healthy place. And the Santa Ana Building Healthy Communities has online, you can locate it for yourself, a strategic plan. So they're telling you what their intentions are for these next 10 years. On the planning committee were people from the OCCCO. So they're part of this plan. So presumably the member churches, the member congregations are in some sense part of this plan. So we open up the plan. We look at what this strategic plan is, and it's quite extensive. It wants systemic changes that, quote, create integrated services and systems. Among those changes, it wants health promoting land use and planning. Land use plans include healthy and affordable housing, safe and open spaces, access to healthy food options. It wants youth development, education and career opportunities, jobs that pay livable wages. It wants community engagement. This is a complete managed system. Every aspect of an individual's life is going to be supervised, managed, controlled, whatever word you want to put in there, through the government by its mediating agents. This chart is taken from that plan, that strategic plan. And if you look at it, at the top of the box there, those represent the residents in a neighborhood. And those residents are organized under block leaders. The block leaders are then responsible to precinct leaders, who are then responsible to neighborhood, to zone leaders. And the strategic plan says this is a necessary structure for community empowerment. It's a necessary ingredient for social change. No one's voted these people in, but they've arranged this. The reason for it is to develop community leaders. Again, I'm reading from the plan. In order to engage local residents, mobilizing them to effect changes in local institutions, such as city government, schools, police, and then it goes on to other things. This is stunningly like a similar system that they had in the Soviet Union. Soviet just means council. And the Marxists initiated it in Russia initially to challenge the state. But once they had achieved power, then it became a way of micromanaging the population. The enormity of the systemic change that you're looking at there is so great that one almost loses sight of the fact that although this is using religious institutions, this is not a religious system. This is a secular system, and all that that means. Its ethical foundation, and again, I'm not making this up, I'm taking this directly from the plan itself, is not natural law. It's not God's law. It's consensus values. There is a consensus statement within the plan. Quote, the Santa Ana Building a Healthy Community Plan is the product of a community engagement process, a process to move the region forward in a common vision for healthier, more equitable, and safer Santa Ana. Now, nobody in Santa Ana, except for those few individuals who appointed themselves, was involved in making this consensus vision. So the fact that it engages local churches to help create the system means that they have nothing to say when it comes to the system's problematic elements. When the Santa Ana plan brings Immaculate Heart Catholic Church into a public relationship with a contraceptive provider, Clinica Choc, as it does, the Catholics aren't supposed to be concerned that Clinica Choc is a contraceptive provider for teenagers. It's just part of the system. So when the system says it's planning to establish, as it does, quote, more free or low-cost one-stop clinics providing a full range of services, Catholics are expected to passively accept that and not explore what this full range of services entails. If you were to ask the OCCCO leaders, are you supporting birth control? They would say, no, that's not one of our issues. But those kinds of issues pervade their issues. So this slide lists another set of affiliates with another Olinskian network. This is called the Interfaith Worker Justice Network. These are the California affiliates of them. It's a little confusing because the statewide network is CLU California. CLU is an acronym which stands for Clergy Laity United for Economic Justice. And then some of the local affiliates also have CLU in their name. So there's CLU Ventura County, CLU Orange County, but then there's still other affiliates that don't have any, they have their own names. But they're all parts of this Interfaith Worker Justice Network. Well, so CLU in Orange County is one of these affiliates. And like many other of the affiliates from this network, they were very involved in helping to sign people up for the health care exchanges for the Affordable Care Act. About a year ago, CLU Orange County invited its member clergy and congregational leaders to a training. It's called the Community Health Connectors Training, which was designed to, quote, equip faith and community leaders. So this is designed for faith and community leaders with basic information to allow them to guide their communities. These are faith leaders to guide their faith communities through the health programs of Medicare, Medicaid, and children's health insurance programs. Okay, let's make this simple. So we're going to start with the federal government up here. That's the Health and Human Services. That's the department of the federal government that is tasked with implementing the Affordable Care Act. But it has agencies within it. And so the specific agency that is going to work with faith-based communities is the CMS, Centers for Medicaid and Medicare Services. CMS works with something called urban strategies. It's a propaganda machine, which creates this training, this community health connectors. CLU OC gets its congregational leaders involved in the training and then feeds people back up into the federal program. Yeah? Now, why go through the faith communities? A Community Healthcare Connectors Communication Toolkit, which was, in this specific case, it was designed for people with diabetes and disabilities, but they explain why they want the faith communities, and it applies to all the aspects of its work. Quote, faith-based organizations are a trusted source of information. Now, they don't mean they're going to get information from the faith-based communities. They mean the people that are within the communities trust their institutions to give them good information. If your priest tells you the Affordable Care Act is the best thing since sliced bread, you're more inclined to trust it than if you hear it on television, is the government's assumption, and probably a good assumption. So faith-based organizations are a trusted source of information and a dependable extension of the community that understands its needs and challenges. They serve as a valuable gateway to hard-to-reach populations to communicate culturally relevant messages. Translation. They're useful. Faith-based communities, organizations are useful to the government because the people trust them. The government can use them, therefore, to reach the congregation. Conversely, why are faith-based, why are our religious institutions attracted to this? One of the organizations that is directly associated with the HHS Center for Medicaid and Medicare is something called the Christian Community Development Association. It's an organization that goes back into the 60s. It was founded in Mississippi, and it includes about 350 Pentecostal churches. Why would they get involved? Well, they're dealing with some of the poorest communities in the country. They're staunchly pro-life, but they've been persuaded that this is going to help their people, and that's why many of them get involved. But again, this system is not a Judeo-Christian system. It's a system on the shifting sand of consensus. And as we all know, the Affordable Care Act has brought to light a plethora of moral problems. Because health care resources are finite, it argues that judgments have to be made how to allocate them. So, for example, what resources are appropriate for the elderly? There might be a way to talk about these things in a Judeo-Christian context. But in a secular context, in a world of amoral consensus values, the notion of rationed resources becomes terribly problematic. And after having listened to Dr. Byrne, we have to use a different language. So we're going to look at this at the state level. This is a slide now that shows the Virginia Interfaith Center for Public Policy. This is a Virginia, that CLU was a set of affiliates from California of the Interfaith Worker Justice Network. This is your Virginia local affiliate. If you look closely at its membership, you'll find that it not only has religious institutions, it also has political groups such as the Soros Center for American Progress. And it has unions and other secular public policy groups. One of the center's projects is a Virginia Consumer Voices for Healthcare, VCV. ACB's goal is to build a coalition, quote, that includes patients, community and religious organizations, small businesses, organized labor, community health centers, advocacy organizations to support the expansion and improvement of healthcare in Virginia, namely getting people signed up for Obamacare. And it also does advocacy work. It was Interfaith Workers Justices Network ground troops that helped the state to push the Affordable Care Act, or was pushing people in the state to support it. It's also an active supporter of the National Women's Health Week, which is a nationwide initiative about maintaining abortion rights and free contraceptives. The center is also working to expand Medicaid in Virginia along with Planned Parenthood and NARAL. You get the picture. And they're also involved with end-of-life politics. So in 2009, clergy that were involved with this center, with this affiliate of the Interfaith Worker Justice, met with Virginia Senator Mark Warner, who had introduced legislation that would expand Medicare's hospice care for the terminally ill in the state. The legislation was designed, among other things, to offer counseling on establishing these living wills. Senator Warner argued that with more advanced planning and counseling, end-of-life care can be less expensive and save Medicare about $15 billion over 10 years. This wasn't passed, neither was his reintroduction of it in 2012, but it's back again. It's under a new name, Care Planning Act, which last time I looked was still in committee, but it's going to keep getting pushed. National Right to Life, which isn't always the strongest supporter of life issues, but they say of this bill, so if they're saying it, I mean, perk up your ears, quote, it's to be used to exercise subtle or not so subtle pressure on patients or family members to agree to reject life-preserving treatment. So even they get it. We could examine this kind of activism through a lot of groups. I'm only limiting my focus to the work for those that are Alinskyan organizations that are working within faith-based institutions. You've heard other speakers mention the Coalition to Transform Advanced Care. It's a national alliance of groups that are working towards end-of-life issues. It includes healthcare professionals and also faith-based organizations. And it's involved with advocacy work. It pushes legislation and it pursues public policy. Advocacy is always more effective where there's a public engagement component. And that's where another area in which these faith-based, these Alinskyan organizations become very useful. So it's no surprise to learn that public engagement is a component of the coalition's work. There's a lot of experimentation going on right now. Socialized medicine is new to the US. So CTAC has launched a pilot program in Oakland, California involving the faith-based community. PICO, which is one of these networks, has an affiliate in Oakland, and like the PICO affiliates around the country, it was very involved in getting people signed up for the Affordable Care Act exchanges, health exchanges. And PICO, this PICO affiliate also supports the CTAC work. One of its member congregations hosted an interfaith leader consultation in 2013. Now, there are legitimate reasons why faith-based institutions ought to be concerned with end-of-life issues. The state of a person's soul, concern that people not be dying alone, not dying in unnecessary pain. The problem is that the CTAC project is not a faith-based project designed by people with traditional moral values. It's a secular program that's using the faith communities to get people of faith to buy into it, including the amoral relationship to death. CTAC is a proponent of these advanced directives and all their glorious ambiguity, and one of CTAC's member organizations is the Conversation Project. It's an initiative to get people talking about their subjective wishes for the end of life. So some people might want aggressive medical intervention at the end of life. Some people might want minimal intervention at the end of life. Some people might want to have the doctor bump them off. It's a very secular program. The Conversation Project makes itself available to congregations. Its faith-based advisor is a woman named Reverend Rosemary Lloyd. She's a Unitarian minister and a proponent of euthanasia as a compassionate option. She also works with another Olinskian network, the IAF, its affiliate in Boston, which she says was the key force for their achieving health care for all in Massachusetts. Well, health care for all in Massachusetts was the prototype for Obamacare. And thanks to the IAF, universal health care in Massachusetts included abortion coverage, birth control, and sterilization. And now again, thanks to the IAF, there are conversations being held in our churches about whether or not we want to be euthanized. Many of the people who are involved in pushing these advanced directives express bewilderment that anyone would object to what seems so reasonable to them. One doctor lamented, quote, "I am truly baffled. We are making practical recommendations for everyone to be taken care of in the way he or she would want to be." Close quote. Who would object to giving people the option of killing themselves? Who would object to doctors and nurses becoming practitioners of death? A letter this summer, 2015, from CTAC to the U.S. Senate Finance Committee, which includes Senator Warner, supports the proposed Care Planning Act and recommends a series of policies that align with it, including case studies, those are best practices, that illustrate how these policies will look in practice. One being, quote, "a planned community engagement to make advanced care planning part of both the community and healthcare culture." And in some areas of the country, this is exactly what's happening. Olinskian organizations are working with their member congregations to conduct end-of-life conversations that have no traditional moral foundation. Which means that we have to have a really high level of vigilance. This is just one state. But in the Diocese of Richmond, its Office of Justice and Peace, for instance, has been a participant in the National Healthcare Decisions Day, which in its own words exists to inspire, to educate, empower the public and providers about the importance of advanced care planning. I do understand the need for Catholics to be having these discussions, because if we don't have them from the Catholic perspective, it's more than likely that we'll be getting them from the secular perspective. Which is why we have to be really careful where our information's coming. The National Healthcare Decisions Day resources includes links to Compassion and Choices, which is a leading component of physician-assisted suicide. Its presence in a Catholic function makes it look like this is an acceptable moral option, and it's not. I'm going to close by thanking Dr. Byrne and Doug and Ione, who's not here, for their incredibly thankless and tireless work in exposing the assaults against human life as it nears its end. Medicine is experiencing such rapid technological advances, and the country is undergoing such dramatic social change, not to mention structural transformation, that there's a lot of misunderstanding, even among Catholics, about the various moral dimensions of the issues that are facing us. My very minor contribution to the conversation is this. For many decades, but with rapidly increasing frequency, Catholic parishes and dioceses are being caught up in Olinskian organizations that are pushing statism, liberationism, and all the immoral elements that entails: abortion, same-sex marriage, sterilization, birth control. It may be too late to stop our country from flinging itself over the cliff, but I hope and I pray that we can wake up the church.